Hello and welcome to the Two Gals and a Mic podcast. I'm your host, Sue Kerber, and on today's show, I'm sitting down with Dr. Jen Stevane to chat about what it looks like to create a holistic approach towards surgery. Dr. Stevane is a mom, an avid outdoors woman, and a board-certified general surgeon who's shifting the paradigm to bring the best of Eastern and Western medicine together to care for her surgical patients. Dr. Jen, welcome to the show.
Thank you so much for having me. This is very exciting.
I'm so excited that you're here. I'm really excited to hear about this amalgamation of Western medicine and Eastern medicine. But before we get into this fascinating discussion about that, why don't we start with your journey to becoming a surgeon? How did you get into this profession and why did you choose it?
Well, I'm a third generation physician. So when I was a teenager, I had zero interest in becoming a doctor. I was a lacrosse player at the College of William and Mary and a history major planning on going into law school. I hurt my shoulder shooting a goal one game and ultimately had surgery on it. But I found a woman in New York City who was a surgeon, mom, top of her game, athlete, and she ended up operating on me and becoming my life mentor. I worked for her for a couple of years as the research assistant of her group, and that cemented my desire to become a surgeon. I liked the thought of having a problem that I could fix with my hands and then move on. So I went to medical school expecting to go into orthopedics, which I then found quite boring, and decided to go into general surgery, which was a little bit more exciting and looked more at the whole patient. So that's how I got into general surgery.
As a general surgeon, what does that mean? Does that mean that you can do surgery on anything?
Basically, a general surgeon is an abdominal surgeon and also does a little bit of everything on the rest of the body, mostly the soft tissues and skin. So on a typical clinic or operating room day for me, I could be operating on breast cancer, melanoma, sort of lumps and bumps that are irritating to people, hernias, sort of holes in the body where they shouldn't be, colon cancer, gallbladder surgery, appendix. When people get appendicitis, I'm the one that they call, and sometimes trauma surgery as well.
So you were practicing, or you started your practice over on the East Coast, and then you made your way out west. How did you find yourself in Bozeman?
I went to medical school in Pennsylvania, and during that time met my then husband. He is a fly fishing outfitter here in Montana, and it is difficult to transplant a fly fishing guide from Montana to anywhere else in the country. So when I finished my medical school, I went to Virginia Mason in Seattle, where I had my general surgery residency for 5 years. And then once that was finished, I was able to start my practice in Butte, Montana, and recently have moved to Bozeman and am practicing in Livingston.
So we'll get into this in just a minute, the way, as I referenced at the beginning of the podcast, the way that you are integrating Eastern and Western medicine. When you were going through all of your training and your schooling and even your practice in Butte, was this part of your practice, or is this something that's new? Were you trained strictly in Western medicine?
Yeah, as an MD, we're trained strictly in Western medicine. I think DO physicians get more training in nutrition and manipulation like chiropractics. As an MD, we got zero of that. The transition happened during COVID, where I had a chance to get some really good targeted massage therapy for some old injuries. And when I was walking to that massage therapy room, I passed an acupuncture room, a nutritionist room, the chiropractor's office, and then I went into the massage room. And I thought, why am I not doing this for my surgical patients? When I go into surgery, I joke with patients, it's sort of like a controlled car accident. It's a trauma, it's a stress on the body. And yet, as a surgeon, we don't talk about nutrition, stress, probiotics to optimize patient stress levels and outcomes after surgery. And it kind of hit me like, I've been missing this for so long. I'd also had some patients with wound healing issues. And sometimes the easiest way to get them better is just to modify their diet and add some vitamins. And I had great results. So that was about 4 years ago. I've since made it a part of my practice and would love for the rest of the surgical world to adopt it and understand that there's so much more to the patient than their surgical disease.
Let's talk about this a little bit more, because I know that one thing that you've expressed to me is that one of the biggest challenges that you've faced in your profession is the dogma. It's the way that Western medicine works. Was this that you just described your defining moment? And what prompted you to go from thinking about these things to actually acting?
I started doing some research on articles that examine the relationship between more Eastern type medicine practices and outcomes in surgery. And I found that really interesting. I'd never read about acupuncture and breast cancer, acupuncture and pain, yoga and PTSD, yoga and pain. And it was really exciting to find that there was a significant amount of data that wasn't well known to me in the surgical world, but a significant amount of data that showed better outcomes. And that may be as simple as the stress level of the patient was better after surgery or going into surgery, because that to me is as important of an outcome as the success of the surgery itself.
What does stress level have anything to do with a successful surgery?
The comfort of the patient going into the operating room is important. There is data showing that stress compromises immune function, stress compromises pain tolerance. And so if we can take something as complex as stress, but as simple as stress, and improve upon that, then even if I make an incremental improvement in their pain, in their ability to fight infection, in their ability to heal wounds, then that to me is a success story.
You said that you transitioned from Butte, you came over to Livingston, and I'm assuming this is probably post-COVID, after you had this aha moment and you started making these correlations. In order to do that, did you have to get any specific training in Eastern medical practices?
I read a lot about functional medicine and people like Dr. Mark Hyman, who have really pioneered that sort of area of medicine and taken the important aspects of functional medicine and applied it to the surgical patient. Now, if somebody is interested in Eastern medicine, such as, herbals, remedies, I do in-depth look into that so that there isn't a side effect of those medicines on surgical outcome. I try and keep it as clean as possible, so to speak. So when I recommend vitamins, I'm very specific about which ones, because I want to enhance their healing, but not increase risk during surgery. I've not taken any courses on Eastern medicine, but what I have done is talk to my colleagues in those parts of Eastern medicine. I don't have the bandwidth to take that on, to be honest. But if I could get together a team of colleagues in Eastern medicine who are interested in helping me help the surgical patient, then I can do what I'm best at. And the acupuncturist can do what she's best at or he's best at. Chiropractics, I can bring those people together. I have done some research on how alternative medicine has helped surgical patients. And that has led me to sort of pick and choose which alternative medicine colleagues I think would be best for my patients.
How do you broach this with your patients? Like, what does that conversation look like?
Yeah, it's interesting. I mean, some people have zero interest and some people think it's very interesting. I just met a woman who has exhausted a lot of Western medicine options. And she and I had the conversation that the best approach for her may be going to these alternative therapies. If somebody tells me they're a very spiritual, energy-based person, that's a pretty good indicator that they're going to be open to these other forms of therapy and healing. There are other people who haven't even thought of it. My basic intro to all patients is that, hi, I'm Dr. Jen Stevane, general surgeon. I take a holistic approach to my patients. So I'm going to be asking you some questions that you probably haven't been asked before. And then I ask about vitamin D, their sleep, diet, their stress level, if it's controlled, support at home. And so I give them an introduction that they're not going to get the typical questions from a typical surgeon. And most people are interested and they're like, wow, why are you asking me about this? And then I get to say, well, listen, if you have good sleep, your pain's going to be better. If we take care of the 3 to 5 pounds of bacteria that are living on and in us that we ignore every day, your pain is going to be better. Your inflammation is going to be better. Your stress is going to be better. We have to work with these systems to optimize the person who has the surgical problem. And that is what's exciting for me.
I think that that's really fascinating because in my own experience, I've only had one surgery. That's enough. Sorry, Dr. Jen, but that's plenty. And it was scary, right? It was scary to know that you're going to go under the knife. For me, it was a lower back surgery. So it had to do with my back, my spine, which was even scarier. And we never broached these types of conversations. It was really just all about, let's get in there, let's have the surgery, let's patch you up, send you home. And that's it. It would have been fascinating to me to have had a provider who offered some thoughts around here's some options for better healing. And you're not just about the healing part, right? You're also about the pre-surgery.
There's a new term called prehab, and that mostly looks at mobility and strength from what I've seen. My ideal world would be a couple weeks before surgery, you cut back on sugar intake, you cut back on processed foods, you cut back on the inflammatory components, you add in vitamins so that the reserves that are already low, because most Americans with our diet do not get the vitamins that they need. We fill up the reserves so that when the body needs them, they've got plenty there. If I could work with that patient and their positioning and the type of surgery they're having, say some chiropractic or massage therapy or acupuncture therapy, so that the position that they're in during surgery is better understood, and the impact of positioning, the impact of not moving during surgery is taken care of. I mean, imagine lying in one position with your arms out or tucked in blankets for a couple hours at a time. Maybe your head is up, maybe your head is down, maybe your legs are bent, maybe they're not. I just feel like we're missing taking care of the patient that is going through an incredibly complex procedure. Even the simplest little hernia that I fix is still a complex procedure. They're getting an IV, they're getting a tube in their throat. All of these things add up. And so I'd like to take care of the impact of all those little details on the patient.
So you once said that the world is full of messages about who we should be and the paths that we should take. I can speak from personal experience that sometimes it's really hard to affect change when you're in a system where things have always been the way that they are. Have you experienced any opposition regarding your approach, and how did you quiet the noise?
A lot of my colleagues are incredibly thoughtful and compassionate towards their patients, but they don't have the mindset that they need to take the time to evaluate all these other aspects of the patient. They also don't have the time, and the system is not built for helping the whole patient go into surgery. So I've talked to a bunch of my friends and colleagues, and they think it's cool and an interesting idea, but they aren't ready to change their practice and promote this. I think that change in medicine is hard. We have done a lot of the same things for a lot of years just because that's how it's been done. I think with COVID, there's an exciting opportunity to take advantage of this new mindset where taking more zinc or taking more vitamins is going to help you not get COVID or long COVID. And so if the patients and the physicians are more open-minded, this is the time when I can talk to colleagues and say, listen, if it's working for COVID, why aren't we doing it for our patients? What I have found is a lot of the alternative medicine colleagues out there are very excited about the idea. They have been naturopaths, chiropractors, acupuncturists. They're very open to helping me get a more holistic approach towards the patients. They're also very excited to talk to a surgeon of Western medicine, because for so long we've sort of acted like we know how to do what we do. And it's been very successful for the most part. More and more people are going to alternative medicine physicians. And I think that they have a lot to offer. We certainly don't know everything. I know the microbiome of the soil is terrible, but how that impacts my patient, I'm not totally sure. So if we can find somebody who's going to help with the microbiome over here, so that my patient is the most healthy over here when we're rolling into the operating room, that's the kind of colleague I want to work with.
So how do you create that success? I mean, what does that look like? Is it more training? Is it more conversations? Is it getting leadership on board?
I almost wish I could create primary care for the surgery patient. If insurance companies were on board, I think that would be very helpful. If insurance companies gave an incentive to patients to change their diet before surgery, start a walking program, I would see that as successful. What I'm trying to do is take simple little changes and have patients who wouldn't consider it. The most success would be if orthopedics had a holistic approach to their patients, and urology and neurosurgery and general surgery. I think a lot of it can be encompassed under one roof, and then you have separate, surgery specific algorithms for it. That would be super cool. My dream would be to have a general surgery clinic with an acupuncturist, a holistic nutritionist, a psychologist, chiropractor, massage therapist, like all the things, so I could get my patients in the best spot before we go into surgery, and then right after they go right back to them.
With your vision, I would imagine you would have to have a primary doctor. Would that be the surgeon that would oversee all of those aspects of care so that there's coordinated care?
If there's a primary care provider, either an internist, family medicine, PA, nurse practitioner, who's willing to do the full holistic evaluation questionnaire, and then also be open-minded and say, listen, we can help your stress with this medication, or here's a meditation app, or here's an acupuncturist to call, and then we tailor it to what the patient is interested in. You can keep it simple and very personalized. And I think the patient will feel better because they're being seen, and that's important. Everything that I do comes with risk, everything that I do. And so if I can get the patient to be as comfortable and primed going into surgery, then I've done my job to lower the risk as much as possible.
Do you have a story that you can share, maybe of a time when you've gotten great results and outcomes from this kind of approach?
There was a very healthy woman who came into my clinic with a bad full thickness wound to her leg. She had been trying to get it better with what sort of conventional medicine had suggested for her. She also told me that she was a Reiki specialist. So this was like perfect as somebody who would be open to this approach. And so as the sort of Western doctor, I figured out that her wound was actually 3 times bigger than it was. And I got it to a point where it was going to get better. And then as the holistic approach, we started her on wound healing vitamins, specifically A, C, D, zinc, and arginine. And then we worked on her sleep because her sleep pattern wasn't great. And she had a remarkable recovery. Now, would she have gotten better without all of those extra elements? Maybe. However, I know without a doubt that she was more comfortable with her injury. She was empowered in taking care of herself. And that was really important to her.
You know what I love about this approach is that the things that you're talking about are not only important and impactful for a situation like surgery, but really they're things that, as we talk about on the podcast, you can take into your life and continue as wellness practices. I mean, I've heard you talk about meditation, yoga, things that reduce stress, walking, very simple things that if you do on a daily basis can really have an overall impact to your health. That's pretty incredible, especially if the introduction comes at a time when you're going through trauma.
And I think that that's a cool part of it. I mean, a lot of breast cancer is curable. I say to patients, the bad thing about breast cancer is it happens to lots of women. And the good thing is it happens to lots of women because we have so much data and such a good cure rate. But when you have your life threatened by something like breast cancer, if we can use that as a jumping off point to get our vitamin D to a level where we're not only going to heal better from surgery, but our mental health is going to be better, where we can learn that acupuncture and whatever energy channels there are within the body will actually decrease the stress going into surgery. And then you go right back into it. And maybe we can reduce lymphedema and pain. If we can use that as a jumping off point, then I'm happy to take a scary situation to do that.
So let's shift gears for just a minute. I mean, we've obviously talked a lot about your profession and this incredible work that you're doing to help people heal. But Jen, you're also a mom of two, and you are committed to raising two really great people. How do you balance the pressures of your high-powered career with the needs of your family, and then also finding time to do those things that you love to do, like ski and travel and the things that replenish your soul and help decrease your stress?
It's a lot, but I've learned that mindfulness is a really great way for me to stay in the moment. I have also decided that I'm going to limit my clinical time. So I have time at work and then I definitely have time at home. That's allowed me to stay sane. I've found ways to find joy and contentment in my life when I'm sitting at the beach and being able to take in the surroundings in a way that I hadn't before. You know, the smell of the air, the sound of the waves, the seagulls. You can focus on one of those and really pull yourself back down to where you are instead of getting lost in scrolling of the phone, the complications that are happening when you're not there. That's been helpful, but it's not perfect. I've learned to ask for help. You know, when I am on call and I have my kids and I'm a single mom, I pay somebody to be on call with me in case I have to go in the middle of the night. I've been blessed with the ability to do this job. I've been blessed with these two kids. I also have found that if I feel guilty about putting myself first once in a while, that is detrimental to my job and my parenting. If I decide one day that my daughter has to take the bus to school because I want to go have a latte with a friend, that's okay. There is so much martyrdom in being a woman and being a mom. There is certainly so much in being a doctor. I used to say it's not a job, it's a lifestyle. And I used to want that. I used to want to be the martyr and say, listen, you know, the patient is more important than this family gathering. But that didn't fill my cup at the end of the day. And I think that's where the social pressures get to us and they tell us what we're supposed to do. You're supposed to do everything for your kids and put yourself last. Well, you know what? That didn't work for me. And I don't think it's working for a whole lot of women. So maybe try something else. And if it doesn't work, you can always go back to being the martyr. But if you can sit there on the beach and have a quiet moment, maybe your kids are fighting over there, or maybe they're enjoying themselves, whatever. If you take a moment for yourself, it's so much healthier. And I found that it's a much fuller life.
I say that all the time, that self-care is not selfish. And I think we need to move past this idea that it's not okay to take time, just as you were saying. You kind of mentioned, you didn't use the word, and I'm going to throw it out here, boundaries. And I've had a lot of conversations with a lot of different women about establishing boundaries and sticking to boundaries. Feedback that I often get is, I don't know how to do it, whether that's because I don't want to be perceived as aggressive or as non-compliant or not the martyr or all of these things that we've been talking about. How do you, practically speaking, establish boundaries, and how do you stick to them?
I think it's much easier for me to make boundaries in my profession than it is for me to make boundaries in my personal life. You know, I feel like there's, at least in clinic, there's an end of the day, right? On a very personal level, I think lack of boundaries led to some dark years and a difficult marriage and a very difficult divorce. And that was a big lesson. So if here I am, I'm going to do everything. I'm going to make the decisions. I'm going to be the surgeon. I'm going to be the mom. But if you don't make boundaries, then you don't actually create partnerships with people. So as uncomfortable as it is, I am doing a lot of work on boundaries. I have figured out how to do it in my profession, and I am figuring out how to do it more with my family. I'm doing it. I'm making the boundaries. However, it's really uncomfortable, and we're not supposed to do it. We're going against the grain if we're drawing lines in the sand as a mom or a woman.
But do you feel empowered as you do it and as people respect them?
I think that you have to have a lot of self-assurance to make the boundary. And then once you make the boundary, that will lead to more confidence and self-assurance and respect. And then you keep the cycle going and it just gets healthier and healthier. And even though it's scary, you do have better relationships with boundaries. I thought no boundaries, best relationship, not asking anybody for anything is ideal. And that's wrong. I was wrong with that. It's sort of like this trust fall. I'm going to make the boundary and I'm going to trust that on the other side of it is something better.
And just speaking from my own experience, sometimes they're not well received. And sometimes you do suffer some loss and you do have to navigate through some hard stuff. But if you keep at it, maybe this is your experience as well, and you just keep pursuing it and you hold steadfast to those boundaries that you've created, in the end, people respect them. And I think that people come around. It's kind of like learning how to deal with the new version of you.
And I think that you find out pretty quickly who is going to be supporting you and what you need and the boundary that you need, and who is just going to take. And making boundaries is going to protect you in the end, and it's going to surround you with the best people. And like you said, that may lead to some loss, and that's scary. In the end, it's a more fulfilling life. And my kids will see that. I want my kids to see boundaries are okay. And they're not just okay, they're imperative.
Well, that's how you bring up really great humans.
That's my goal, to be accepted for who you are and what you need. When you talked about self-care and it's not selfish, that goes back to the holistic approach to the patient. It's really empowering the patient to take care of themselves and their needs at a very vulnerable time and have boundaries. So I think that there's some empowerment and boundary setting for the patients to do what's best for themselves.
Jen, what's next for you?
I have joined this group of women, and I would love to create, this holistic approach for the surgical patient, but I can't do it alone. And there are people out there who know business and know how to shift paradigms, and getting those people on my team is a really fun experience. I've not known a lot of people outside of medicine just because it's so demanding of my time. And it's been an absolute mind-blowing experience to meet these other women who have as much like fervor and resilience as I've had to have to climb my ladder. And so I think what's next for me is just opening up my eyes to these other worlds. I don't want to feel like I have to do everything and know everything, and letting these people in and letting them help me is very exciting. I'm expanding my world and it's really cool.
Are you looking to also expand your practice? Are you looking at taking that kind of a trajectory?
I think that the trajectory for the holistic approach to a surgical patient is more in the setting of coaching, maybe having several coaches work with surgical patients. It's rewarding to get people ready and empowered for surgery, and then help them get through the immediate postoperative period until they're back on their feet again. I manufactured a wound healing supplement that I made just with the ingredients that you need, nothing more, nothing less. I wanted to keep it affordable so that people of all types and, the financial structures can get it. I think a lot of people are resistant to full life changes. So what I'm looking to do is find little things that people can do. And if they don't want to go into a month-long coaching program, they could take a supplement, or they could buy a PDF file or watch a video to get an idea of little tweaks that they can make so that they feel good going into an operation. Maybe it's as simple as cutting out soda. Maybe they stop going to McDonald's, or maybe they go all in and do all of the things. But if you make one or two little moves for yourself, that's a win. If I could get a following so that people are able to find me and be healthier as a surgical patient, that means a lot. I hate when things go wrong in surgery, and it's not nearly as hard on me as it is on the patient. And if we can lower those risks, then that to me would be an enormous contribution to society.
Well, speaking of coaching, what's your best piece of advice for how to access the purest version of ourselves so that we can pursue the paths that are meant for us?
I think you need to silence the noise and consider a world where you create your expectations instead of them being created for you. There isn't a whole lot of holistic surgical care, but if people hate the idea, I don't really care because I love it. And so if you find something that is meaningful to yourself, sit with it, change it, pursue it. So to find our truest self, I would say find a quiet place. If you're able to quiet the noise and the social media and the expectations that have been driven into us for so long, then you'll be able to figure out who you are.
Last question for you, Jen. Is there anything that I didn't ask about or that we didn't touch upon that you want to make sure that we don't miss?
One last comment I'd like to share is the importance of vitamin D. Just take your vitamin D. Even though the low levels of normal may keep your bones healthy, you need higher levels for mental health, any type of wound healing, and better immune support. So if there's any easy way to make your health better, in my opinion, it's get your vitamin D levels above 50. And I think if you do that, all of life will be better. I think that resilience and getting up after failure is the key to finding out who you are. I hope that my girls know that I have their back in the sense that they can try all sorts of different things to find themselves. I think that resilience will lead a human to being more human and more joy and contentment. It feels to me that that's the key to reaching goals and to taking risks and enjoying the path along the way. Also, laughter is really important, and we haven't talked at all about that, but I have found that laughter and being around good friends that I trust has allowed me to push myself in ways that I never thought were capable. And like you said, boundaries are important and they'll lead you to who your friends are, but don't be scared. Life is about ups and downs. And if you expect ups and downs, then you can ride it.
Dr. Jen, thanks so much for sharing your stories and your philosophies on the show. I think that your fresh approach to healthcare is needed, and I'm really, really excited to see where this takes you. And listeners, thank you for tuning in and listening every week. Be sure to subscribe so you don't miss any of these extraordinary stories. I'll be back next Friday with another edition of Two Gals and a Mic.